The vaccines are moving us closer to a return to normal life, but experts say another health crisis is just beginning. Our Dr. Frank McGeorge is here with a closer look at the startling number of COVID survivors that could face long-term mental health issues.
We're continuing to learn about the long-term impacts of COVID-19, but it's becoming increasingly clear that a significant number of survivors are suffering some degree of brain injury long after the initial infection is cleared. When Kelly Fields beat COVID-19 after a 17-day fight last June, she was relieved her nightmare was over.
It was an experience I never want to experience again.
But months later, she is still dealing with neurological issues like confusion, brain fog, and memory loss.
I can't recall something that someone told me last week, and they have to keep reminding me, this is what I said to you. That I didn't have those issues before COVID. I didn't have it.
A new study suggests a large number of COVID-19 survivors are struggling with mental health issues. British researchers looked at health records from more than 230,000 COVID patients, mainly in the U.S. A little more than a third were diagnosed with a neurological or mental health condition within 6 months of their infection.
The mental health pandemic is just beginning.
Professor of psychiatry Dr. Madhukar Trivedi says the most common diagnoses have been anxiety and mood disorders. He says the fear and uncertainty of a new COVID-19 diagnosis could trigger a disorder, but so can changes in the brain that might be due to inflammation caused by COVID.
That part of research is still beginning to be understood, and we are doing some of that work. Others are doing around the country. We'll find out over the next 6 to 9 months to a year.
If you are feeling signs of a mental health or neurological disorder, don't ignore it. Reach out to your family or friends and talk to a medical professional for help. Callie says she found support in the Survivor Corps Facebook group.
How long is going to go on? Is this going to be for the rest of my life?
Answers that only time will tell. Now, this is important for two reasons. First, these survivors will all continue to need emotional support and medical services, but also this highlights the importance of preventing more people from becoming infected. Add to this the list of reasons to get vaccinated. Back to you.
Appreciate it. Thank you, Doc. Well,